Assalamualaikum and very good morning. Hello everyone, welcome to our special podcast for today. The topic that we have for today is a hot topic, the breast cancer awareness. My name is Dr Nurhamizah Zulkifli. I will be the host for today for the Sinar Daily's The Life and Style podcast. So today on this special day, we have two remarkable distinguished guests. So on my left handmost is Associate Professor Dr Suniza Jamaris. She is the Senior Consultant Oncoplastic Breast Surgeon from Universiti Malaya Medical Center. So a little bit of Dr Suniza, she did her undergraduate and also Masters in General Surgery in Universiti Malaya, and subsequently she continues to pursue her special interest in oncoplastic and breast surgery in other various countries. And on my left hand side, I have a breast cancer survivor, Puan Farah Abdul Rahim. She was diagnosed with breast cancer in 2014, about 10 years ago, and now she has been 2 years in remission. Alhamdulillah. Breast cancer has remained the most popular, the most deadliest cancer among the women population. So, from this discussion, we would like to dive into the early detection, the screening programs that we have, what kind of different modalities and treatments that is available for the breast cancer patients. Dr. Sundar could actually give a bit of gist and information about regarding the statistics of the breast cancer in Malaysia amongst women and also as men as well.
The recent one that we have is 1 in 23. So it means that in 23 women in Malaysia, one of them can get cancer. So you can see how is our, maybe our lifestyle is already changed, because previously it's 1 in 27. You see, now it's like increasing a lot more patient, 1 in 23. Can you imagine that? There's like a lot more patient coming to the hospital because of breast cancer. And you did touch about men. So some men, I think most of men in Malaysia say that, I don't think that I would be able to get the breast cancer. So just recently I got an experience, you see. One patient that came to my clinic, the presentation is the same, breast lump. Yes. Is men come with a breast lump. So can you imagine? Then with all the triple assessment with investigation, and we confirm that he got cancer. So this is real situation. It's not, it's not really like it's just like from here. You can hear from these aunties or what. This is really my patient.
So it's not like myth and legend that people say men cannot get breast cancer. It's possible for them to get breast cancer. And I heard that if a male patient who get breast cancer, they are much more aggressive because they don't have much breast tissues. So it can invade further and faster. Is that true, Dr. Suniza?
So you can see you can imagine how men, like if you compare with the woman, they don't have much breast tissue. So when they come, it's the breast tissue, the lump, it's obvious. So that's why they realize that, okay, I don't have this lump before, but this is obvious. So most of the time they come because of lump. And then, yes, the treatment must be a bit aggressive. Why? Because they don't have breast tissue. We cannot just remove the lump, you see. So we have to be more aggressive. We remove the whole breast instead of just a lump.
I understand. How about the age group, Dr. Suniza? Can you just explain a little bit in terms of the prevalence of the age group?
Okay, when you see in Malaysia, the young patient always say that, okay, I don't have a risk of breast cancer, but our statistic actually showing the pickup, the incidence is common at more than 50-year-old and above, and it's actually peak 55 to 65. That is the common age of patient having breast cancer. But having said that, I do experience the patient who is 24-year-old, having a breast cancer. So I can't deny this. So I can say that the age increasing, when you reach more than 50, that is when the screening is necessary, because that is how the older you are, the higher risk of you can develop breast cancer. But bear in mind, young patient also. We also have a young patient with the breast cancer.
And the young patient, the they're a bit more challenging to manage, isn't it? Because they are in reproductive age groups, so it's much more challenging in terms of that, isn't it?
Yeah, it's because 24-year-old. I just share an experience. 24-year-old. Can you just imagine 24-year-old? It's just like I just graduated. What should I do now? I got the breast cancer. Can you imagine? You know, if we compare with the one that is already older age, they're just going to start. I'm going to work. How am I going to work if I already got a breast cancer? So all this is also in terms of how am I going to marry? You know, can my spouse, you know, really accept my condition or not? That is, there's a lot more to discuss if you're talking about young breast cancer.
All right. Okay. So moving on. What are the modalities of detecting a breast cancer? So we know that we have ultrasound, we have mammogram, we have MRIs. So which one is actually the best modalities, or should I say the accurate most? I mean, is there that we do a bi-model, meaning that ultrasound and mammogram better? How do we go about that?
Okay. So in terms of screening, when we talk about screening, it's totally different from diagnostic. So if it's screening, whoever at the age of 50 and above, we advise to get a mammogram. Why? Because a mammogram, it can detect the earliest stage of cancer, for example, ductal carcinoma in situ, that can easily be detected by mammogram. Because when you say that I don't want to do mammogram, I just want to do ultrasound, the ultrasound sometimes we will not be able to detect, like for example, microcalcification that can be seen in a mammogram. So obviously the in terms of screening modality is actually in our guideline is mammogram. You know, it's not just ultrasound. If a patient said, look doctor, I just want to do ultrasound. So it is not up to our standard guideline. Our standard guideline is always mammogram.
So like you mentioned just now, the mammogram age for screening purposes will start about 50 years old. Is that right?
Yes.
Okay, so then the patient will be asking how frequent that they have to do. For example, at the age of 50, they have done the screening and it's negative. Do they have to do it every year until they menopause or until they are 80 or 90? And how do they go about that?
Yeah, very good question, because I do have a lot of patients asking, okay, Prof, can you just stop my screening? But it's actually what guidelines say. We always say we always stick to the guideline. So our guideline said we start at 50-year-old, we stop at 74-year-old. But you can see sometimes in UMMC we have a patient who is 74-year-old, is very fit, you know, fit enough to say that she can have a life expectancy like more than 10 years. Okay. I would still advise to continue mammogram. So how frequent it is? No, if a patient has no cancer, it's just like screening purpose, is like 2 years, every 2 years.
So now I'll just like go into Kak Farah, okay? How would you share in terms of your diagnosis at that time, during that point of time? How was you being diagnosed, and what was the support during that time? I mean,
okay,
how would you go about that?
I was diagnosed in 2014, and before that there was no symptoms, nothing. When I checked, there's no lump, nothing. But when I went for my annual pap smear and mammogram, yes, you have to do pap smear and mammogram. It's so important. I started late. I started my pap smear only after my last child was born. So I started late 30s. And because I did my pap smear, I just went along with the mammogram. So after, it was mid-30s, after 35 was when I started, and it was an annual thing, pap smear. And because I do my pap smear, I just do my mammogram. Okay. So I was diagnosed at 46. So like Dr. Suniza was saying, you know, mine, alhamdulillah, it's not as challenging as someone who's in the 20s. I've had my kids, been there, done that, breastfed, you know, so everything was, it was less challenging, less things to think about, you know, because I'm already married, you know, I can empathize with those that haven't got married, you know, I want to have babies, I want to, you know, what if I have to remove my uterus, you know, so the challenge is totally different. So I was diagnosed in 2014, and it was through mammogram. It was a routine thing, and then the only difference was after my mammogram, my gynae said, okay, Farah, I need to bring you to a surgeon. You know, so that was the difference, and I could sense something
Was not right
amiss,
during that point of time.
So when they showed me again, Alhamdulillah, the cancer, the tumor was one big lump.
Okay.
It wasn't scattered across the breast.
All right.
So I didn't have to remove the breast. When I found out, I wasn't. I don't know. I mean, I wasn't alarmed. It was just okay. So what do we do?
Okay.
You know, what next?
Right.
What do I have to do? And I'm very lucky. I'm very blessed. I have a very supportive network. I mean, and I think it's very important that everyone has the support unit, you know, and my support unit doesn't smother me. It's not suffocating. They're there for me, and they know that I can reach out to them anytime I want to. You know, they don't hover and, you know, don't do this, don't do that. No.
They're not telling you what you need to do.
they're not
You should do
telling
like this. You should eat this. You should not eat that. No, nothing like that.
Because, and the thing is, most importantly, my husband is very supportive. He lets me decide what I want to do. He doesn't tell me what to do. He listens. I mean, you know, okay, I have to remove my lump. I have to, and then years later, I have to remove my breast.
Okay.
And he had no issue about it. He lets me decide, but he'll ask, do you want my input? He asks. He doesn't give me unsolicited input.
He doesn't direct you.
No, he asks me, do you want my opinion?
Okay.
And then, but ultimately it's my decision what I do, because he says it's your body, you know best. So for that, I appreciate. I mean, that one is a blessing, because everyone needs a support system that will support you through thick and thin. You know, no judgment, and they're not thinking about themselves, they're thinking about you, because you are the one that matters. You are the one going through it.
Yes.
You know, so you will know best how to cope. So a support unit is very important. So I had a lumpectomy. I removed my lump immediately after I found out, and then I did not go through with chemo, not because I'm against it, but because at that time my kids were schooling, and I asked all the questions. You know, how long will my downtime be if I take chemo? You know, if it's the conventional chemo, how long will I be down before I can get up again? Because I know that it's very tiring. So when they told me, I said I have to wait. I can't do conventional, because who's going to send my kids to school? You know, who's going to do the school runs? Who's going to send them for tuition? Who's going to, you know, I can't afford that. So for that reason, I didn't do. But again, everyone, you do you, okay? I mean, everyone has to do what's comfortable for them. So I didn't do, not because I was against
Chemotherapy.
Okay,
Yeah.
so it was just because I couldn't afford the downtime. So I went with alternative. I went through everything. I mean, everything. And again, nothing against alternative, nothing against conventional. For me, ultimately, whatever that you choose, you have to be yakin. You have to believe and have faith that whatever that you do will work. So for some it works, for some it doesn't. I mean, you know, so that's life. So I went through alternative, but it wasn't so successful. And 2016, my lump, there was a new lump at the exact spot that was removed.
So there was a recurrence at that
Yes,
point
there
of
was a
time.
recurrence. And of course, I didn't do anything. I mean, I continued with my alternative treatment. And then because when they removed my lump in the first time, the nodes were removed also. So, you know, it gets a bit slow,
swollen,
right?
yeah.
Yeah. So for the second time, things were really bad when my hands were swollen. And it grew to be as big as my calf, actually. My parents freaked out. So they said, you have to go to the doctor. I mean, you know, how long is, you know, something is wrong. So when I went, my surgeon was very nice. Again, you see, my support unit, I'm so blessed. She didn't judge me. She just looked and she said, okay, you have your reasons for not doing your chemo, but you need to see this oncologist. I want you to see this oncologist. And she literally made an appointment for me to see this oncologist. And I met up with the oncologist and we decided, okay, I start off with hormone pills. Then a year after the hormone pills, because apparently the hormone pills suppresses the growth
Exactly.
of the tumor, and following that is the oral chemo. So I didn't go through conventional, I did the oral. It was capsules,
Okay.
tablets. And I think most importantly, everyone who's going through this, you have to find a doctor that you are comfortable with. There is no best doctor. The moment they become a specialist, they become an oncologist, they are experts in their field. The important thing is you go to an oncologist that you are comfortable with, that is in sync with you. My oncologist never told me what stage I was, but because of my condition, I knew what stage I was, but
Okay.
never once did he mention to me what stage I was. And for that, I'm very grateful. That's another thing for anyone. I mean, I'm not giving advice. Far be it for me to give advice, okay? I'm not an expert. But in my experience, if you discover you have cancer, your first question should not be what stage. That's irrelevant to any cancer patient, actually, because the stage of the cancer is for the doctor. It's a short form, basically, because if you say that you're this stage, when it's a communication between doctor to doctor, so that the doctor doesn't have to elaborate what size it is, it's spread to where, and all that. So between doctor and doctor, when they say this stage, they automatically know, okay, what's the condition. For a patient, it's totally irrelevant what stage you are. What's more important, the moment you find out you have cancer, is to find out, what do I do to get better? Focus on getting better, not what stage you are, because it's irrelevant. You can't do anything about what stage you are. So I find that's very important. And I always tell anyone I know who's got, because everyone who finds out I have cancer will ask, what stage are you? And I go, what difference does it make to you what stage I am? Right? It doesn't make any, it's totally irrelevant.
It was the treatment that you are going through, isn't it?
Exactly. It's, you focus on your circle of control. You can't control what stage you are, but you can control what you do to get better. Okay, so, and when I find out, when I have friends who have cancer and they come to me, and then they say, I'm this stage. Doesn't matter what stage you are, right? So right now, so far the tumors have been behaving themselves. I sort of have it, so far, alhamdulillah, it's under control. So I'm blessed to be given a second chance.
So, Dr. Suniza, we just want to go back, like what Kak Farah said, that knowing what stage you are is, for her, is not very relevant. But is it really important for us to know? I mean, like, on your point of view about this.
Right. Very good question, because different patients have different opinion. Yes. But for us, as a doctor, as a physician, we always mention about the stage of the disease. As you know, if you have a stage, you know that cancer has 4 stages: first stage, second, third, and fourth. So because, as what you know, is even some patients come with advanced disease like stage 3, they can still be cured. That is important thing. And for the stage 4, it's not really to be cured, but it's actually for the
Control the disease.
Yeah, to control the disease, to really alleviate the symptoms, to make sure that patient comfortable, you know. And if you talk about breast cancer, everyone will always say that this is a death sentence. It is not, because breast cancer, if you are stage 1, stage 2, stage 3, it still can be treated. It's curable. That's the words I always tell the patient. It's curable. You know, it can be treated. So you don't worry about this, what we are going to do. But if you come early, stage 1, stage 2, there will be a less in terms of complexity of the treatment. However, if you come at the stage 3 and stage 4, then you can imagine how complex it is, because as you mentioned, you do experience that you need to go for chemotherapy, you know, radiotherapy, hormone treatment, so on and so forth, you know. But if let's say you are stage 1 or even the stage 0, you know, sometimes you just have a surgery, then you've been treated already, you know.
So you just go for follow-up after that. No need to take any hormonal
why
pills.
It's very important for us to tell the patient about the stage. But as I'm not against you, but everyone have their opinion. But the important thing that I would like to say is the earlier you come, the better in terms of your prognosis, in terms of your outcome, outcome of the treatment, because if you stage 1, stage 2, the response will be very good. It means that as you have a statistic, stage 0 patient will survive after 5 years, 100% survive. How about stage 1? 98%. Means that 100 patient, 98 of them survive after 5 years. So, but how about stage 4? It means that it's tremendously, only 20% survive. So you can imagine 100 people, 20 women survive after 5 years. So that's why we always encourage patients to come for screening for early detection.
Yeah, sorry, I must correct something there. After my surgery, I did meet one oncologist. Automatic, you meet an oncologist. He already told me what stage I was. I mean, it is the doctor's responsibility, of course. And because I already knew my stage, the second oncologist that I went to didn't have to reinstate.
Emphasize back again.
So we went. His focus was, okay, let's get you better. And that's why I said, like I said before, you have to find a doctor that you can sync with.
So you can share, you can, like they understand you, not just to direct you. And
you go in and you don't, you have to feel better when you leave the hospital and not more stress when you leave.
So like what Kak Farah said regarding she did a lumpectomy, subsequently she did a surgery to remove her breast. So Dr. Suniza, just want to ask in terms of the current changes, in terms of the surgery per se. Most of the time, some patients, they will tell you that I don't want the surgery, I don't want my breast to be removed. How is it? Do I need to remove my nodes? So I can just enlighten us regarding the surgical advances that we have. I mean, are all breast cancer needs to be removed entirely, or is there any what we call breast conceiving surgery? And in your expertise regarding the oncoplastic, what do you have to say about that?
Okay, when we talk about, since I'm a surgeon, of course I will always talk about technical part, because when you say is breast cancer, is always involve two parts of your body, which is the breast cancer with the breast area and the lymph nodes. These two things must be out. Not all. How we decide is based on the patient's factor or the surgeon's factor as well as the disease factor. So when you talk about patient factor, not all patient can undergo lumpectomy. So in which circumstances the patient can can do lumpectomy? So again, I re-emphasize here is the early detection. If you come early, stage 1, stage 2, it means that the lesion is very small. Like stage 1, it's like less than 1 cm. It's like a pea. I mean, the size of pea. The size of pea is very small. So of course, if it's very small, we can just remove the lump. But if let's say you come with a very huge one, like size of egg, quite big. So if compare with breast tumor to the breast ratio, it is not possible to just remove the lump, But we do have an advance in terms of oncoplastic, as you mentioned. What is this about? Is basically you remove the tumor, and then you do some sort of like technical surgical to put the fat. You already remove the lump. There will be a cavity, so you put something else, from your body to just fill up the cavity, so to make it like more aesthetic, more natural.
So this is what we call the fat transfer.
We do have local flap. We do have local flap means that it's autologous. It means that from our body. So we also have implant, which is we use for breast reconstruction.
Right.
So if I talk about oncoplastic surgery, it's more like you just remove a lump. But if you talk about reconstruction, you remove the whole breast and you replace the breast with either implant or with your flap that you mentioned just now.
Okay, right. So moving back to Kak Farah, just want to ask, during the course of your treatment, almost at 10 years, what is the most challenging part as number one? And number two is that how it have changed in terms of your work, maybe in terms of your lifestyle? Because I've heard you have, after your surgery, you have actually done she actually have done like a lot of amazing stuff. She have actually climbed Mount Fiji. She's actually climbed Mount Kinabalu and just came back from Perth from skydiving, isn't it? Yeah. So
Bungee
can you just
jumping too.
bungee jumping too in New Zealand? Yeah. So that's a spirit that we want. So can you just share actually what are the challenges? Not only like nice things. So what are the challenges that you have gone through?
Well, there are challenges, but you see, for me, I think it's more the mindset. It's very important, your mindset. I mean, when I found out, again, I understand that the struggle is real with a lot of cancer patients. I understand that. I have lost loved ones to cancer, so I don't take it lightly. But what I'm saying is, it's important for our mindset. We have to have the correct mindset. Now, for me, this is just my experience. When I found out, it wasn't so much why me, but it was more, Alhamdulillah, I'm the chosen one. Out of all the people to be tested, I was given the test. And I consider that a blessing because there must be some good in this. So my challenge was more, every discomfort was, I have to manage the discomfort because my arm was painful, the nodes, the swelling and all that. It was very unpleasant. But the challenge was more, it's not healthy to show, for me. Again, everyone is different, everyone you do you. But for me, it was important that my children don't see the struggle because they were still schooling at that time. So it's very important that for them, because I know now, the Umi has left this legacy to the daughters. Okay, so, and I don't want them to think that cancer is bad. It's just an illness. God has given you an illness. He can give you a cure. So I had to make sure that my kids saw cancer as just, okay, it's cancer. Yeah. Like you have a cough and a cold, you have cancer. Yeah. No biggie, continue, life continues as normal. So that was my challenge, to make sure that my children, if I'm uncomfortable, I do not show it in front of them. And what changed for me was, after I found out I had cancer, I don't sweat over the small stuff anymore. Because for one thing, stress induces all this. Cancer loves when you're stressed. So I can't afford to be stressed. So I let go of, I'm a control freak, and I think my kids still think I'm a control
personality,
freak.
Is it?
Yeah, but I think I've mellowed down a bit, but my kids beg to differ lah. But I think you don't sweat over the small stuff. Things that you can let go, just let go. Learn to delegate. You don't have to know everything that's going on. You can trust others to handle it. And for me, my focus was, now that I am blessed to be given a second chance, so I concentrate on my being. What do I want to be? As opposed to what do I want to do. So it's my being that counts. I want to contribute. I want to be a positive need to my loved ones. I want to leave things better than what they were before whenever I go somewhere. So I focus on the being because I'm given this second chance. So that is the difference between before. Before I bathed in the stress. I mean, I take on the stress. But right now I'm thinking it's not worth it. I mean, just move on. I mean, just leave it to someone else. And for me, and again, it's really literally for me. It's let go, let God. I mean, He gave it. He led me to it. He'll lead me through it. So for me, it's you take each day as it comes. I mean,
so basically trying to be positive about it, and like when life
not
gives you
trying,
being positive about it.
There's no trying. There is no alternative to it. There's no alternative. I have to be positive because everything He gives is good. Everything is a win-win. Whatever He gives is a win-win. So there's nothing bad about this at all, really. I mean, if I didn't have cancer, I wouldn't be having this bucket list of the things I want to do. I wouldn't have experienced bungee jumping. I wouldn't have done skydiving. I wouldn't have gone up Kinabalu. I wouldn't have gone up Fuji. Had I not had cancer, I would still be,
in that your
in my
safe
comfort
zone.
zone, doing the things I used to do, nothing big, no contribution, no impact, all left to anyone, so yeah.
All right.
That's
So
what
before
changed.
we move on, we are moving back to Dr. Suniza as we have time to catch up. So what would be the how if a patient said in terms of the follow-up for this patient after they have done a surgery? Just now you said the screening you have to do 2 yearly, but in terms of the patient who already diagnosed with breast cancer, how would be the follow-up in terms of these patients?
Okay. Whenever we have a patient diagnosed with a breast cancer, we will, of course, tell them what will be the next treatment. Of course, that is the first thing that they would like to know, because they want to know how are they going to plan, as what you mentioned, are they going to plan the treatment. So it's very important, because this is not only about her, it's also about the family, how patient going to manage a family, as what Kak Farah mentioned just now. I think it's very important for them to know about that. Okay, so we mentioned about all these treatment, and how about the follow-up after the surgery. So after the surgery, they will go for the chemotherapy. Sometimes they have another radiotherapy followed by other targeted therapy, because some treatment like targeted therapy, it goes up to 1 year, you see. And for the hormonal treatment or endocrine treatment, as what Kak Farah mentioned just now, it up to like 5 to 10 years. Previously, it's just 5 years, but now after the study show that it's better to continue 10 years.
Okay.
So you can imagine they have to take about 10 years. But it's just a tablet form of treatment. Okay, it's not something that is sinister. It's just tablet form of treatment that the patient have to, continue. So with this medication, they have to come to CS, not only to just to get the medication, but also for the examination. Like in clinical and real situation, we will ask the patient whether is there any recurrent symptoms, is there any new lumps, is there any, like as what Kak Farah has experienced, lymph edema, swelling of the hands, because all this important because there is part of the complication or even a complication from the treatment itself, so patient can develop a swelling. So what will be the next step, for the patient? So we can actually refer them to occupational therapy, physiotherapy, so that can be reduced. As I suppose, as what Kak Farah said, it's like it can reduce, So it means everything can be treated, it's curable. And then for the first year of the treatment, we normally see in UMMC, we normally see 3 monthly. Every 3 months, we see patient, see the patient's condition. Is there any other recurrence, not only local recurrent, also systemic recurrent, means that is there any spread to other part of the body or not? Yeah. And then how the compliance in terms of treatment, the tablets, did you skip the tablet or not? So we can re-emphasize during the time, and also we do a clinical breast examination, and at the same time patient will have a mammogram. Mammogram will be yearly, but our assessment will be 3 monthly for the first year. And then after subsequent year, until 5 years, then we will do every 6 months. So you can imagine, this is all about scheduling appointment. So if you're working, it is very terrible. You need to really tell the patient, look, this is our follow-up, and then what do you expect? And then probably you can make sure that everyone around you knows that you are not simply go to the hospital just for whatever, but it's actually for your intense treatment and intense follow-up.
All right, so very, very intense discussion. So before we actually wrap everything up, maybe Kak Farah, what is your advice? I think you have gave a long, lengthy advices to the breast cancer survivors or those who have not gone for screening. So what would you say to the public out there?
No advice. Again, I'm not an expert to advise, but excuse me. Do go. You must check. You must check your body. Don't be afraid to check. If there's nothing wrong, there's nothing wrong. And if there is something wrong, fix it. No big deal. And if you are confirmed with, don't take it as a death sentence. It's not. Just like Dr. Suniza said, it's just an illness. If you have to go monthly, go monthly. If you have to go every 3 months, go every 3 months. Do not
Skip.
miss. Yes, take your medicine religiously. If you don't take care of your body, no one else will. Everything is up to you. Whether you get better or not, put aside, everything is in God's plan. Because God gives you a plan, but you have to work at it, So, do what you have to do to get better. It's not a death sentence, it's just an illness. And every illness has a cure. So, do whatever it takes, because life matters. Life matters, and you have to do something to preserve that and live life to the fullest, because God's giving you a chance. I mean, we see people dying of cardiac arrest and all that, and we are so blessed that God gives us the second chance by saying, okay, you have cancer, improve your life. Do what you need to do, because something's not right. So fix it. You're given a second chance. So take it. Don't worry about it. It's not a death sentence. Inshallah, everything will work out fine if you think it will work out fine.
It's all in your mind.
It's all in the mind. The mind is so powerful. I just cannot stress how important. You tell yourself you're going to get well, you're going to get well. You tell yourself you're going to get sick, your body will fall sick. So everything is up to us. And we can do this. We can fight this. There's so much advancement in cancer treatment right now. I mean, and it's not one size fits all anymore. Every single patient has a different treatment, even though you're going through the same. I have cancer, you have cancer, but your treatment is totally different from mine. So everyone has a chance to get better. It's just up to us whether we want to or not. So all the best, everyone.
Okay, the last few minutes, Dr. Suniza, what would you give the advice to the public? Any misconception that these patients would have? They don't want to come to the hospital, they are afraid. So anything that you could give, piece of advice for all the viewers and also the listeners out there?
Yeah, I suppose we heard a lot about the misconception of a breast cancer death sentence. Men will not have breast cancer, young patient will not have breast cancer. All this misconception is like happened to my, that is real life. Come to my clinic in front of my in my room, saying that I'm 24-year-old, I have a breast cancer. All this is you need to know that even though you are young, it doesn't mean that you are not, will not have cancer. Similarly to men, I don't have breasts. So I don't have a chance to get a breast cancer, but I do experience of treating breast cancer patient, men breast cancer patients. So what I'm a piece of advice for all of you, early detection save life. The earlier you come, the better in terms of outcome in terms of treatment, and the less complex in terms of management. Thank you very much.
All right, thank you so much to Dr. Suniza and Kak Farah. So as a one line of conclusion, as what we have heard from both of the panels, early detection. So don't be afraid if there's a small, even a pea of, like a lump the size of a pea, just come to the hospital. Make sure that you guys are screened and also get the treatment right. Okay, thank you for joining us today. You can listen to all our Sinar Daily's discussions on all of our podcasts, streaming platforms, and follow us at Sinar Daily MY on all social media platforms. Thank you so much, everyone, for listening to us. Bye.